This is great.
So good afternoon to everybody who is watching at home as well. My name is Rob Curtis. I'm the Alumni Relations Coordinator with the Faculty of Rehabilitation Medicine here at the University of Alberta. Thanks for tuning in today. I'm streaming from Corbett Hall, the home of the only freestanding rehabilitation faculty in North America. These days, I normally work from home, and getting in the car to drive here to start up the live stream is actually way more physical activity than I get on some days. So I'm looking forward to hearing our presenters' tips today and starting to incorporate more physical activity into my own work days. There's one housekeeping item before we begin. We've planned a lot of time for questions today, and the way that the Q&A will work in this live stream format is through the text chat. So everybody who's watching can type questions into the chat, and they'll only be visible to me on my screen here. Feel free to type them as they occur to you as the presentation's going on or later on during the Q&A session. With so many people watching, we anticipate a lot of questions, so I'll do some triage. I'll pass the questions on to the presenters verbally, and I'll do my best to get to as many questions as possible, but please understand if we're not able to get to every question or if I have to group a few questions together sometimes. As well, we encourage you all to use the hashtag RehabMedLive if you're live tweeting or posting any work from home pictures on Instagram. The Faculty of Rehabilitation Medicine is a world leader in rehabilitation science, physical therapy, speech-language pathology, and occupational therapy. Our researchers, faculty, students, and alumni are enhancing lives through rehabilitation around the world. We've created this new live stream series, Rehab Med Live, so that we can make their expertise available to you as a resource at a time when it's needed more than ever. The first president of our university, Henry Marshall Torrey, famously said, as I said last time, that knowledge must not be the concern of scholars alone. The uplifting of the whole people shall be our final goal. Today's presenters are all about uplifting the community and giving back. Sunny Deol, Rob Heimbach, and Brandyn Powelske are all graduates of the physical therapy class of 2015, and they've continued to be involved with the faculty as volunteer examiners for the OSCE exams and interviewers for the MMI exams, and Brandon's also a current PhD student in rehabilitation science. They've found a new way to give back to the community today by sharing their expertise with all of us. And we're so grateful to them for putting together this presentation for us this afternoon. So Sunny, Rob, Brandyn, welcome, and I'll pass the floor to you.
Thank you very much. Thank you, Rob, for having us come in, and thank you to the Faculty of Rehab Med. It's something that's very important to me, as the faculty has given so much to me and to Robert and Brandyn and I. And we just wanted to give back in any way that we could. And as physios, this is the best way we could give back and provide a lot of tips for a lot of people that find themselves sitting more due to the current crisis or the pandemic. And we want to make sure everyone's staying healthy. And that's what we were taught in school. So we wanted to pass some of the stuff off we learned, and also some of the stuff we find clinically. So we thank you to the faculty for letting us do this with you, and we thank you to the U of A as well for coming together as such a strong group and remaining strong for students and faculty members. So great job to you guys as well. So yeah, I don't want to get too emotional here, but I'll get started. I'm just going to do a screen share here. So I'm going to do we have a little bit of a presentation to go to, so we're going to be kind of going back and forth between a slideshow. Rob and Brandyn, you can see this?
Yeah, sounds good, Sunny. We can see that.
Good. So we got the working from home stretch. So learning objectives, like any presentation, we got some introductions, we got a background of prolonged sitting, the impacts of prolonged sitting, and effects of short bouts of activity. And then it's activity time. We're going to get people to get up and get moving. So between Brandyn, Rob, and I, we have different aspects of this. I'm going to be going through some of the effects of sitting or prolonged sitting. And then Rob's going to go through some research about what the effects of short-term physical activity is. And then Brandon's going to go through a bit more research and how to objectively measure change. And we're also going to go through a video of activity to do. So we've made a stretch program and a high intensity interval training, a HIIT workout too, that everyone can follow, and it should be a lot of fun. So stay tuned for that. So with introductions, I'll let the handsome guy on the left introduce himself.
So my name's Rob Heimbach. Like these other two lovely gentlemen, I'm a University of Alberta graduate. I went through the kinesiology program and the physical therapy program at the U of A at Corbett Hall there. And just let me say thanks so much for having us on today. And thanks to everyone who's tuning in today to watch. And hopefully we can answer some of your questions. Yeah, I've been working in private practice physical therapy since graduating. I have kind of a special interest in running injuries and sport injuries, as well as vestibular rehab. And I'll pass it off from there.
And the guy in the middle is me, Sunny Deol. I'm a physiotherapist and a clinic owner. And I'm also a graduate of the 2015 class, along with Rob and Brandon. So it's quite special that we all get to work together as well. It's quite a treat to go to school with these guys and then also work with them professionally. So in terms of my practice, I like to treat everyone, but I guess my specialties, you could say, is TMD rehab, cervical lumbar spine rehab, and dealing with a lot of like Olympic and Olympic lifters and power lifters. So I guess those are like my sporting interests. And yeah, I just like coming to work every day. And I'll let the guy on the right introduce himself too.
Thanks, Sunny. Thanks everybody for coming out here today virtually to listen to us. And as my two colleagues have mentioned, I was in the same class with them at the university here. I've been working in private practice ever since. And as Rob mentioned earlier, I'm a current PhD student under the supervision of Dr. Greg Kawchuk, looking at group-based management programs for people with low back pain. So Sunny, I'll pass it back to you here.
Well, thank you. I will get started. So a lot of what we're doing today is based on peer-reviewed evidence. So we pulled a lot of articles and did a big review of these things. So we have the titles of the articles listed. So if anyone wanted to search them while we talk or afterwards, feel free to do so. So our life has changed currently. And it's allowing us to work from home, which is great, but also leads to maybe some poor or not ideal ergonomics and things like that. So you're sitting for a long time working from home, posture might not be ideal. You might start noticing some headaches or some neck pain, back pain, things like that. I can contest to that. I usually, I'm a physio, so most of my days spent with patients and things like that. So I'm always moving around and I'm always up and about. So for me to sit still is very, very difficult. So I've been noticing some pain as well that I'm not used to having. So prolonged sitting has been shown to be associated with increase the risk of the following: cardiovascular disease, there's some support with that, metabolic syndrome or type 2 diabetes, obesity, hypertension, some cancers, depression, musculoskeletal problems, and premature mortality. So keep in mind that these things are with prolonged sitting over years. So it's not like, over the last month and the next 2 months, if you're sitting at home a lot, it's not like anything serious is going to happen. So we're not trying to make you feel bad by looking at this, but if you do spend a lot of time sitting, then it might be the time to make a change and start moving and get a little bit healthier. So for today's talk, we're more focused on musculoskeletal problems and some cardiovascular disease. So we're going to be talking in more detail about that. So quite a few negative outcomes of it, but the good thing is it's preventable. So we can actually help with these things, and you can do a lot of things on your own. So for musculoskeletal dysfunction, we're looking at the lumbar spine in this slide. So low back pain is the leading cause of disability globally, and that's shown in multiple studies. Sitting for prolonged periods of time has been reported to be associated with low back pain, regardless of whether an individual is currently experiencing low back pain. So if you had previous episodes, you might feel better. This could exacerbate things and cause pain whether you've had it or not. Sitting involves the flexed postures between 50% to 97% of end range of motion for extended periods of time, so it can cause a lot of strain to these tissues. So when joints move away from neutral, the tissues surrounding the joints are subject to increasing levels of stress and strain. And I'll kind of show you on my body what that looks like with bad posture. Can trigger nociceptive signals and instigate inflammatory and cytokine responses. So Brandon's going to be talking a little bit more about the pain response. Sitting for durations from 1 to 7 hours for 5 consecutive days is associated with immediate increases in low back pain. So you can see even just short as an hour for 5 days straight can make some sort of impact, and decrease activation of multifidus and erector spinae muscles and weakness of abdominals and buttock muscles. So when you're sitting, certain muscles are not being activated as much, so you get weakness in those muscles. So that could be one of the explanations of why you have some pain, and an answer is to work on those muscles. So the exercise program that we have developed works on all these problematic areas and allows for kind of like a whole body workout in a very short amount of time, which we'll go through. If you look at musculoskeletal dysfunction in the cervical spine, you can see quite a few things there as well. Prolonged sitting often causes neck pain and headaches, so cervicogenic headaches, and referred pain to the upper limbs. So that can happen in a number of cases. Like for me, I'm getting a lot of soreness in my traps and shoulders. Other people could have headaches along the back of the head or the temples, and it can be a significant issue. So, and people who are tuning in, definitely let us know and let us know your story and kind of know what kind of symptoms you're experiencing. So causes similar to the back: long-term muscle tensions of the neck and shoulder muscles. If you're in the improper posture, certain things are really tight, and that which stabilize the head during excessive neck bending. Burden to soft tissues, but also joints of the spine. So the CT junction being one. Weakening of deep muscles of the neck, rhomboids and serratus anterior muscles specifically. Hypertonicity of pectoral seen as well. So the anterior head translation when you're poking your head, and I'll show you later what that is. And tendinitis, degenerative changes, and pressure on nerves is seen as well. And increased pressure on intervertebral discs. So this isn't to make you feel, bad about anything. It's just that these are some of the things that can cause it. And the good thing is that we have a solution to that. So if I exit my screen here and I guess show you me. So you guys can see me now, right? Okay, good. I just want to make sure I'm doing a good job. So if we're sitting for prolonged periods of time, right? So if I'm working on my desk, like this is going to be good posture, my shoulders forward, what happens is my thoracic spine is getting more kyphotic, so it's bending more like this, right? And if that happens, you can automatically see that my chin is poking a little bit, so I'm getting more lower doses of my neck. And then my low back is also flattening, so you're losing lordosis of your low back. So you doing this forward shoulder posture affects all those areas. If you simply just bring your shoulder blades back and straighten out your back, that helps a considerable amount. And I always tell people to continuously do that while they work. Just set a timer on your screen, and every few minutes, or every 15 to 20 minutes, work on posture. The exercise that we show will help as well, but posture I always like to throw a little bit in. All physios like to do that. So keeping your shoulder blades back, keeping straight, and making sure you're doing those things along with the exercises we're going to show you. It's never just doing one thing, it's doing a multitude of things to help you guys out. And then I'll throw it over to Rob for his part.
All right, and I'm going to see if I can get my screen share going here at the same time. And we'll get this up. Are you guys seeing my slide okay there?
Yeah, I can see it.
Okay, perfect. So like Sunny said, there's all kinds of different things you can do to sort of like break up those prolonged sitting postures during the day. Yeah, I'm going to try to sell you guys a little bit on frequent exercise breaks with a little bit of intensity to them. So we'll say kind of like at least a moderate intensity of exercise. So we're going to suggest that you integrate some movement into your workday. Like I said, kind of some moderate intensity movement. And you might be thinking like, movement, that sounds great, but isn't it easier to not move? And you'd be right. So there needs to be some kind of like incentive. So you're going to choose to expend this extra energy and you want to get something back out of it in return. So the first thing that we'll go over here is an improvement in cognition, or kind of getting some better brain function as a return on the investment that you're going to put into your physical activity. So the first study that we have up on here is a systematic review looking at 8 different studies that examined the relationship between sedentary behavior and cognitive function. And 6 of those 8 studies found a significant negative association between sedentary behavior and cognitive function. So we have reason to believe that we should get better cognitive function if we get a little bit less sedentary. Looking at the second study here, the breaking up prolonged sitting study, we want to know like what kind of exercise is going to give us the best kind of bang for our buck when it comes to cognitive function. And in this second study, participants either remained seated for 5 hours or interrupted their sitting every 30 minutes with a 3-minute moderate intensity walk on a treadmill. The group that exercised had superior choice reaction time, which just means reaction time involving kind of a quick decision in response to a stimulus. And in this study, they used a computer program to measure this. So what the experimenters took from that is simply that moderate intensity exercise, breaking up prolonged sitting, seems to improve cognitive function. Moving on here to our next study, they had 15 healthy participants and they measured cerebral blood flow while they sat for 4 hours. So the groups either took no breaks, took 2-minute walking breaks every 30 minutes, or took 8-minute walking breaks every 90 minutes. So longer breaks, but longer in between. So they found that 4 consecutive hours of sitting led to a decrease in middle cerebral artery blood flow velocity. So basically less blood getting to the brain. Interestingly, this same effect was observed in the group that got a longer walking break every 90 minutes. But in the group that did 2 minutes of walking every 30 minutes, this effect was attenuated. So there seems to be something about shorter and more frequent exercise breaks that helps to keep blood going to the brain. And then moderate intensity seems to be good. And like I said, making these exercise breaks frequent seems to be important as well. If you're a stickler for details, you might notice that this study is about 35 years older than the other studies that I've referenced. 3 reasons for that. Number 1, I just wanted to show that this is kind of a timeless topic. It's not just a new fad. Number 2, I like that they were kind of measuring something other than an output from the brain, like a reaction time. They were looking at blood flow, so kind of taking a different perspective on it. And the third reason is that I only noticed this morning how old this reference was, and it was too late to swap it out. So yeah, that's an older one, but still a good one. The next study down here at the bottom. So there's different kinds of exercise that we can choose to include. So this one is looking at low intensity, continuous exercise done throughout a session of sitting. So this study, they either had participants sit normally or sit and pedal on an under desk kind of bicycle during a simulated workday. And what they found was that unfortunately, musculoskeletal discomfort and mental state deteriorated equally in both groups. So there was no clear benefit to the under desk cycling. So again, this kind of points us towards the idea that we might be getting the best effects from breaking up our day with frequent and short duration bouts of exercise rather than kind of longer duration and very low intensity. So moving away from the brain now, what can breaking up your sitting with exercise do for your cardiometabolic health? I think that it's pretty well established that sedentary behavior is linked with greater all-cause mortality. You can sort of reference back to the slide that Sunny went over there with the different risk factors associated with being sedentary. So lower cause of all risk mortality seems like a pretty good thing to pursue. So our study here at the top is a meta-analysis that looked at 37 studies to compare intermittent exercise with continuous exercise and with continuous sitting, aka no exercise. They found that the continuous exercise group, they did 1 session of exercise either before or after prolonged sitting, while the intermittent exercise groups, they had their exercise sessions kind of broken up throughout the sitting period. So again, those more frequent, shorter duration exercise breaks. What they found was that both the continuous exercise and intermittent exercise groups outperformed the sitting groups in all measures. The intermittent exercise groups did slightly better than the continuous exercise groups when it came to blood glucose measures. So it seems that whatever exercise you're managing to get in is better than no exercise at all. And this study gave a slight edge to intermittent exercise over continuous exercise. Our next one down here, basically this is another review. This one looked at 20 different studies, and basically they found high quality evidence that light to moderate activity breaks kind of reduce those kind of post-meal glucose and insulin concentrations. So again, like favorable outcomes with a bit of intensity. And moving on to our next one here, the Benatti study. So again, this one is a review, and they found that breaking up sitting with low intensity exercise or with standing breaks, so we're kind of more at the low intensity end, those kinds of interventions had positive effects in sedentary and in diabetic populations, but they found that participants who were younger and fitter needed to get a bit more activity intensity in order to see the same benefits. So again, this one is kind of steering us towards exercise with a little bit more intensity to them. Our middle study here, basically again, they found better outcomes with walking breaks as compared to standing breaks. So just more evidence kind of saying like standing's probably good, but getting that heart rate up a little bit is going to be even more beneficial. And then our last study here at the bottom was a randomized crossover trial comparing sitting with high frequency physical activity breaks, which were 2 minutes of exercise every 30 minutes, and with what they called low frequency physical activity breaks, which were 10 minutes every 3 hours. Exercises in this study were performed at 65% of peak oxygen uptake, so at a pretty good intensity. This study found that the higher frequency physical activity breaks, so that again was about 2 minutes of exercise every 30 minutes, were more effective in kind of controlling insulin response. And if we kind of remember back to that older study from a couple slides ago, it was again the higher frequency, shorter duration exercise breaks that had the best effects on blood flow to the brain. So this seems to be consistent between the cognitive and the cardiometabolic research out there. So in case I haven't convinced you yet with the promise of a better brain and a longer life, I will now pass it over to Brandyn to talk about exercise and pain management.
Thank you, Rob. I'm going to share my screen here as well. Yes, give me 1 second here. Okay, perfect. That should be all online there. So so I'm going to talk a little bit about the short-term effects of exercise on nociception, or the pain sensation. So exercise-induced hypoalgesia, so hypo meaning decreased, algesia meaning pain, is the brief periods of reduced pain sensation during and after exercise. Change in pain threshold occurs throughout the body. Now, the good news is it really doesn't take much to get that sensation or get that benefit. Aerobically, 5 minutes at 70% of your VO2 max, and your VO2 is your exchange of your oxygen with your blood flow. Exercise-induced hypoalgesia can last approximately 30 minutes post-exercise. So take a few minutes to let this have that sink in. Again, really doesn't take much for 30 minutes of a bit of pain relief there. Resistance exercise, 3 minutes of isometric contractions at 25% max voluntary contraction. The EIH there can last several minutes post-exercise. So sometimes with my clients, even I'll tell them at their work desk, if they have a stress ball and they go a contraction at 25% max for 3 minutes, they can get, several minutes of benefit by just doing that at their desk there. So some other exercise-induced changes, these are kind of related to neurotransmitter. So increased serotonin. Serotonin is kind of our feel-good neurotransmitter, generally associated with making us feel good and feeling happy. The next one here is increased dopamine levels. Dopamine levels are, as a neurotransmitter, is found with that positive reinforcement. Somebody gives you a hug, sometimes we'll get an increased dose of dopamine there, or even a positive compliment can do that. So maybe in our virtual world here, since we can't hug people, maybe a positive compliment can boost some of our dopamine levels there. And then just a few other GABA, GABA, and our glutamate, which are our primary neurotransmitters in our central nervous system, has shown to increase those, which generally just increase our function of firing of those cells there. Okay, so all this background information is great. And so how do we objectively measure our progress when we're doing these exercises at home? How do we know that we're getting better? Well, the good news is you don't need a lot of equipment, and one good objective test to kind of measure your VO2 or your level of fitness is what we call the YMCA step test. So all you need is a 12-inch step, a standard stair will do, or a step stool. Just make sure it's secured against the wall so it doesn't slip out from underneath you. A metronome, if you don't have a metronome on your piano. Everybody or most people have smartphones nowadays, so you can download a free app. And a heart rate monitor. Now, if you don't have one, it's just optional. Good old taking your pulse by hand also will do the trick. So to baseline your kind of function, first thing first, you want to take your resting heart rate. And to do this, you need to be sitting down for at least 1 minute's time. And you can take your heart rate, time yourself for a minute, take your carotid pulse or your radial pulse, count how many beats you're getting in the minute. And then what you want to do is you want to start your metronome timer for 96 beats per minute. And you want to start stepping up as you follow the 3-minute timer. So when that 3-minute timer is up, you want to sit down and you want to start taking your heart rate probably within about 5 seconds of finishing that 3-minute step up test. And you want to record it for a minute, and that will give you your recovery heart rate. So what you can do once you're done that is to kind of look where you fall in with some of this normative data based on your age, and also generally you can kind of figure out where you would be as far as from the scale from very poor to excellent. And the good news is even if it's a baseline, you're objectively testing yourself, so you can do better as you progress through any kind of program. Okay, another thing you can do as you do the exercises is to follow along with the scale, the rate of perceived exertion scale. It's a subjective scale, but it's easy to follow along from 1 being very light to minimum exercise, so walking to the TV, nothing too crazy there, to 10, like the hardest exercise you've ever done in your life, where you can kind of barely breathe to keep up. For our purposes and what we're going to demonstrate in a little bit here, we're going to try and keep the rate between probably about a 4 to 7, so more of that moderate zone, but just enough to get that heart rate a little bit more active and get you some of the benefits that Rob was talking about there. All right, Sunny, I'm going to pass this back to you here. I'm going to stop sharing.
All right, so you're only going to see my face briefly for now. So now we have all the evidence of what happens when you're sedentary, when you're sitting for prolonged periods of time. And now we know the benefits of exercise. So now we've developed a program for stretching, so mobility and strength and endurance, and trying to get that done pretty quickly. So with this exercise program, the goal is to do all of it every hour or kind of alternate. So if you could do the stretching program 1 hour, the HIIT program next hour, and then so forth. So trying to do it 2 to 3 times per day each. So you have a stretching program, and then we have a HIIT program. And we're gonna also indicate that if you have any pain or like pain that's not managed in your joints and you're relatively healthy, then continue this program. So if you're healthy, there's no issues, start this program. If you do notice something in your joints and things like that, just be cautious of how you do it. And just make sure that you're not exacerbating any of your pain. We'll go through these exercises. I know we got about 5 minutes to 10 minutes to do this, so we're gonna pass it over to Brandon next to start off with the video.
Okay, sounds good. Sunny, did you have the video active on your computer and I can just talk over it?
Yeah, for sure. I could play it for you. Yeah.
Perfect.
But I think the screen might switch to you if I do.
Oh, okay.
I can play it. I could talk over it here, if that's okay. If you don't have it open. Can everyone see this? So I assume I'm sharing the screen, right?
Yeah, it looks good, Sunny. I think we can see the video there.
Yeah. This is Brandon. So yeah, we have the stretching program to start. So we encourage everyone to try some of these out while you see Brandon demonstrating it. So this is the upper trap stretch. He has his arm under his thigh. Arm goes over to the side and gets a good stretch along the upper trap area. Holding each one for 30 seconds. So you want to do both sides, holding for 30 seconds each. And next up, Brandon's doing a levator scapula stretch. So he's actually looking towards his opposite armpit, pulling down and feeling a stretch in the back of the neck. So you want to feel a good strong pull. You don't want to feel sharp pain. And holding 30 seconds, 3 times again for each side. Next up, we have a great exercise called a chin tucking exercise. So Brandon's going to be sitting nice and tall, tucking his chin and holding for about 10 to 30 seconds as well, stretching all the extensors in the back of the neck. So if you have headaches, this is a good one to try. Just make sure you're not exacerbating any of the symptoms. And next up, you have Brandon doing a scaling stretch with a towel. So a very effective way to do this. Gets a little bit of overpressure, so he can get quite a strong stretch with this. So just got to be careful not pushing too hard. So he's twisting one way while pulling the towel up and down, holding for 30 seconds. Same thing, 3 times. And then next up, we're going to do some mobility exercises for the low back and the mid back. So the next exercise Brandon's going to perform is the cat cow or cat camel. So he's going to be arching his back. So most of the movements occurring in the hips, right? So rotating your hips, arching your back, rotating the other way, and letting the back go down. Doing this for 30 seconds, holding each one for about 10 seconds. Next one, we got Cobra, a very nice Cobra stretch targeting the low back. He's pushing up, and you can do this either with your hands or your forearms, holding that one for 30 seconds as well. And next up, we have a pec stretch. So actually, sorry, a hip flexor stretch. I'm getting ahead of myself. We have quite a few. So he's got one leg up, bending forward, feeling a nice strong pull at the front of the hip, stretching your hip flexor, keeping your back nice and straight, and just bending forward until you feel a bit of a stretch. If it's not too much of a stretch, you can get that back foot elevated on a stool. The last one we're going to do is going to be a pec stretch. So finding a doorway, targeting those muscles. Pecs get very tight when you're sitting with that anterior head translation. So Brandon's got his hands in the doorway, and he's going to be pushing through and stretching those muscles in front of the shoulder. So that's a good pec stretch, 30 seconds, doing that a few times. So I'm going to freeze that and let Rob take over from here.
All right, that was great. I'm going to share screen again here, and we'll see if we can hop back onto the video. Are you guys seeing that okay right now?
Yep, I can see that.
So we talked about kind of alternating on the hour between a kind of a 5-minute stretching program and a 5-minute more intense workout program. So this would be the way to start off that kind of that moderate intensity exercise bout, is with the warm up here. So there's a million warm up exercises out there. No need to reinvent the wheel. You might already have some favorites. We're going to go over a few here, but important to note that the big thing is you want to be safe whenever you're exercising at any kind of intensity. So if you're unsure for any reason, if you haven't been active in a while, it's good to kind of verify and make sure that you can kind of safely get your heart rate up without running into any complications. This warm-up program, it also assumes that you don't have any injuries at all. So it's important, like the warm-up portion, it should not be painful. If it is, then either get creative on your own, talk to a professional, anything like that. You don't want to have pain with the warm-up. Yeah, I would love it if you guys listening could actually do a bit of a warm-up as I'm talking. So it's not mandatory. I can't see you, of course, but our first exercise is jumping jacks. So depending where you are right now, if you can get up out of your chair and start that jumping jack a little bit, that would be fantastic. Again, I won't know if you're doing it, but it would be great if you could. So the jumping jack is, yeah, everyone's seen these before. It's a nice kind of full body warm up. It's going to get some blood flowing both to the arms and to the legs. The goal of the warm up is, as the name suggests, like you want to get warm. So you want to get some blood flowing. You want to feel that heart rate increasing a little bit and the breath increasing a little bit as well. So here's our jumping jack. If that's a little bit too too much intensity or too much impact for you, you can also change it up and do kind of like a step out with that same arm movement. Nothing at all wrong with that. You want to see if you can work each of these warm-up exercises for about 30 seconds. So that's our first one. The next one that we're going to get into here is kind of a high knees exercise. So with this one, I like having the hands up just above waist level to give yourself a target for the knees. This one is going to get those anti-gravity leg muscles working a little bit, a bit of action in the hip flexors as well. If that, again, is a bit too much impact or too intense, slow it down, make it a marching exercise just like that. That's still going to get some nice blood flowing to those big muscle groups. Our third warm-up drill here, butt kickers. So this one, again, if you can do it, you want to get kind of a bit of a dynamic movement going. So like make it a bit bouncy, a bit intense. With each of these warm-up exercises, you're going to get like a little bit of muscle stretch, a little bit of muscle activation, of course, but you don't want it to be like excessively fatiguing or excessively tight. So keep it comfy. And again, if that's a little bit too dynamic for where you're starting from, you can do the same thing, slow it down, make it sort of a marching exercise, getting kind of a gentle pull through the front of the leg and some nice activation up the back of the chain. Yeah, so again, keep them all pain-free. Try for about 30 seconds of each one. If you don't like my examples, like I said, there's a million out there. So pick the ones that are right for you. And yeah, then go from there. Back to you, Sunny.
And I will show you the other part of the HIP program. So last part, I promise. Everyone can see that? I assume so. So we got, I'm just going to hit start on this. Rob's finishing up there, and I'm going to start the next part. So the next part is going to be the strength component of the HIP program, right? So the HIP program, so this is going to be the strength component. So there's multiple things you can do. There's progressions you can do. So for the first part, we're going to do air squats. So doing air squats for 30 seconds. If that's easy or it's not enough of a challenge, you can do burpees for 30 seconds. Again, if there's no pain and things like that, then progress. If you do have some pain in your joints, just stick to the air squats. So that's the first exercise. Second one is going to be doing lunges, right? So we're going to be doing deeper lunges, going all the way down if you can. If you can't, then you can do mini lunges, so going down halfway, and doing that for 30 seconds. very good exercise. I like squats and lunges because they're very dynamic. So if you look at a squat, a deep squat, you're doing hip mobility, ankle mobility, knee mobility, strength for all those joints, strength for the back as well. So it's a very dynamic exercise, and you get more bang for the buck. So you could do a really good workout in, you know, less exercises. So the next one is going to be some push-ups. So we're going to do some push-ups. I'm just talking in the video, so you can access this video later and it explains things a bit, like, even more clearly. So we're doing push-ups for 30 seconds. If that's too difficult, an easy modification you can make is doing push-ups off the knees. If that's still too difficult, then you can do it off the wall. So here we got the scapula active, the shoulders active, so it works on stabilizing that area. So at this point, you should be sweating profusely. Next up is going to be doing some planks. So these can be adjusted similar to the push-ups, so keeping your back nice and flat. If you can't do that, then go off your knees. So doing it off your knees and trying to hold that. Then you have your back and core involved. So you can see that this exercise program does involve quite a few things, right? So you can work on mobility, you can work on stretching, you can work on strengthening, endurance, and everything like that. So a very good program to do. And then even within the 30 seconds, like, don't feel like you have to do it for 30 seconds straight. Let the timer run. If you need to take a break, take a break. A fun thing you can do is see how much you can do in 30 seconds, right? So if you could do 60 push-ups in 30 seconds, let me know. I'll give you a virtual compliment or a hug. I'd say I'd like to give you a real hug. We can't do that right now, but, you know, 30 seconds, see how much you can do. Have fun with it. This only takes 5 minutes for the stretching, 5 minutes for the HIIT program. I think it's a really fun way to do it, right? Rather than just sitting and doing certain exercises, the HIIT program, you know, you can say, hey, to your friend, I did this much, how much can you do? And, you know, challenge them to do a little bit more. So yeah, that's our presentation. And then I know there's some time set aside for questions. So if there's any questions, we can answer those. Thanks for everyone for attending. And Rob, thanks for all the work that you've done in coordinating between us. And I know it's busy for everyone, so thank you for being patient with us.
Well, thanks very much. That was great. I've been collecting some questions as you've been going along, so I can pass those along to you. And if anybody who's watching has any more questions or any follow-up questions, just put those in the text chat and I'll see those pop up, and we'll try to get to those too. Since we were just talking about the 5-minute mini workout, we had a question from Erica wondering how much time you would spend warming up before you started that.
I would just spend that first part of the HIIT program to warm up. So Rob led like, let's say the HIIT program's 2 different phases. One phase is a warm up, so that would take about 1.5 to 2 minutes. And then doing the strength stuff, right? So, and if you do the stretching even before that, and then do the HIIT program right after, it's a very good warm up to do, right? So only go as low for a squat, for instance, as you feel you can do. So, and then the stretching program, just hold those stretches more frequent, or do them more frequently if you find certain issues in the neck over the low back, then focus on the neck a bit more. So we let people play around with it.
We also had a question wondering about kids. So a lot of folks have kids at home right now and are wondering, is this the sort of thing that would be appropriate for kids to try? Would you modify it at all if a kid was doing it? What are your thoughts on that?
I can answer that too, and if Brandon and Robert have anything to say, we can get them to say something. I know for adolescents and things like that, there was multiple studies done with them as well, and that seated posture, prolonged sitting, and sedentary behaviors is very similar to adults, so they do have similar aches and pains, things like that. So in terms of modifications, I think the HIIT program would be pretty fun for them to do. Again, I'd screen them a little bit more closely and see if they have pain. So if you're a parent, be there for the first few workouts and just make sure that they're not experiencing any pain. Stretching, again, sometimes children have a little bit more extensibility in their tissues, so they might be, you don't want them to be pulling too hard. So as a parent or as anyone like that, just to make sure that you're watching them closely.
Yeah, and I think making it fun too, right? If you're doing jumping jacks or even doing some high knees, and doing something fun with the kids, I think that's something that everybody can enjoy.
For sure.
Great. So we've had a couple questions too that are asking about people's specific circumstances, specific stories. So one person is mentioning, for example, sore elbows. So is there anything you might recommend in terms of breaks they're taking throughout the day? Is there anything you might recommend in terms of their posture or their setup that might be contributing to that?
So I think for setup, I know a lot of people are working in not the best ideal office space and conditions, just working at their home right now. And then maybe Rob, you can quote me if I'm wrong here, but I think the U of A Rehab Med put out a little video as well on proper ergonomics for working at home. So maybe that might be a good thing that they can follow up and maybe watch that video so they can have a good little setup in their office. But sometimes elbow pain, you're definitely right, can be caused by wrong computer board angle or mousing techniques. So it might be a circumstance where you might have to play around with a few different office type setups and even maybe trying some left hand mouse. Computer day stuff, even though that's quite difficult. But sometimes changing up that frequency of what you're doing can be helpful with some of those big muscles around your elbows.
Thank you for the plug. I appreciate that. If you're interested in that video that Brenton mentioned, go to our website, which is rehabilitation.ualberta.ca. And under About Us, if you click on Rehab Med Live, that's where you're going to find the recording of this presentation once it's up. And that's where you can find the recording with Dr. Linda Miller, who talked to us about ergonomics a few weeks ago. Another question, and I'm just going to group a couple together here. People are asking about how you might need to adapt this or safety or changes for people with specific challenges. So for example, we have someone who's talking about having neck pain and an instability at C1, C2. There's someone else who's asking about a painful lower back lumbar spine area, possibly related to ankylosing spondylitis. That's a lot to throw at you all at once, but I'm wondering if there's pieces of that you might be able to pick up and give people some ideas.
Yeah, I can answer a few things, and Rob and Brandon again. Rob can comment on a couple of things if he likes. With any low back or cervical instabilities and things like that, I would say just be careful in doing the overpressure, right? So if you're pulling on your neck, don't push into. And I always use the word recreating signs and symptoms. So if your symptoms are a certain type of pain at a certain joint, then you want to avoid that type of pain. If it's some soreness in some other areas just because they're tight, that's not a bad thing. But if you're recreating that pain that you don't like, or the things that cause you the most issues, then you don't want to do some of these techniques. So you can just kind of tilt your head instead of doing overpressure. You could also, if you have ankylosing spondylitis, just be careful with the push-ups and the planks. You might just need to put your knees down and brace yourself a little bit more. Osteoarthritis, if you're hip or knee, then you don't want to go into a deep squat. Squats are still good for strengthening, so you could do like a quarter squat or a 90-degree squat. You just don't want to go super deep. Same with the lunges. So there's some modifications you can make. I'd say, and that's why we wanted to pick exercises that were relatively safe and then have them modified to be even more safe. So having the knees down and supporting yourself for the strength exercises could be a benefit. And Rob, sorry, do you have anything else you wanted to add?
Not too much to add to that. This is maybe not exactly on the C1-2 instability, ankylosing spondylitis, but yeah, I mean, for neck pain and back pain, generally speaking, exercise can be a really effective intervention. So again, if you know of specific conditions that you have that prohibit you from being in certain positions or impacting or loading in certain ways, I think our frameworks can still be applied pretty well with different exercises substituted. So if for example, maybe the push-ups are irritating your elbows, for example, with to go back, you might choose to mix that up with something different. You can still use that same framework of 5 minutes of stretching per hour and that 5-minute little kind of intensity workout every hour. You just might have to get creative with substitutions to keep it comfortable. But but yeah, generally speaking, there's a lot of painful conditions that exercise can be very helpful with too. So yeah, don't do what you can't, but do what you can.
And we had an interesting question here, sort of around the motivation piece. I know, Rob, you were talking about, you know, a lot of the benefits of exercise in the short term and in the long term. We've had a couple questions about motivating others. So, for example, encouraging kids at home to take part. Encouraging, maybe you have a reluctant roommate or a reluctant partner who you think maybe could benefit from this but isn't on board. Do you have any tips for helping with that motivation piece, or, you know, things that you've seen in spreading the word about this to others?
Yeah, so do you mind if I start with this question, guys? Yeah, so I think I always make the joke that dentists have got us real good because we typically always brush our teeth once or twice a day. And it's kind of been engraved in our brain to do so. So I think with that motivational piece, I think it's starting to make it habitual. Once we start to make certain patterns throughout our day habitual and start to really decrease that activation energy of doing it, then it becomes much, much easier. So for example, I think there's even like a few apps out there you can download on your phone, or even setting a reminder that, you know, at 12 o'clock, your phone goes off, you know, starts to ring or whatever. Great. It tells me to get up, tells me to start moving around, to do some exercise. And then, you know, eventually over, you know, weeks to months, it becomes a habit, and then habits become much easier to become lifelong things that you do.
And trying to piggyback off that, I agree completely. I think a lot of the stuff I've seen is on social media and people challenging their friends to do certain things. We obviously can't work out together in large groups, but I think people can challenge one another to do some exercise and say, hey, I did this much in 30 seconds, how much can you do, right? And share it to your friends, and then like start a friendly like competition. Obviously watching your pain. As a physio, I have to put the disclaimer of don't push to the point you're going to cause injury, but I think you can send a lot of challenges to your friends and have, like, you know, using this kind of platform or Zoom, you can actually do group workouts. I do that with my club that I train with, and I set up a Zoom workout. I called it an accountability department, and at the same time every day we train together just as we were at the gym. And if one person attends, great. 5 people attend, it's amazing. It's like, it forces me to work out. Actually, I work out now more than ever, so keep motivated. You see a lot of social media and the use of this wonderful technology that we have, and let's you know, let's share it and try to get some group-based social activity done as well.
If I can just tack my 2 cents onto that as well, I think a lot of the time for like for new exercisers, whether it's like your roommate or whether it's your kid, I think sometimes like keeping the environment like non-intimidating and keeping it fun can be like an easier way to transition those people into physical activity. So for the person who might be intimidated by like going into a gym for the first time, or going to like a group exercise for the first time, I think there's a good opportunity for these kind of like living room workouts where there's nobody watching. You might be following someone on the screen, or following a list of exercises like off your app or whatever you're using. I think it's a great opportunity to kind of like maybe transition people to a point where they feel more comfortable exercising, more comfortable in their own bodies. So I think there's a kind of an opportunity there too with what's going on for home exercises to provide that. Yeah.
Great, thank you. We've got time for just a few more questions. So if you have any last minute questions, anyone who's watching, please feel free to get those into the text chat. There's just a quick one for you. I'm wondering, Shelley is wondering if you have an opinion on posture correctors for office chairs. Good idea or not a good idea?
So to clarify there, Rob, I think maybe Shelley might be referring to like possibly a lumbar roll or other postural correctors for office chairs. So I'll go with that string of thought. I think in general, and I know it sounds funny, but posture is quite variable between individuals. So my posture, Sunny's posture, are very different in how we work in our office environment. And sometimes what works for you might not work for me. So that lumbar roll that I was referring to, yeah, maybe it's the worst thing for my back, and I feel worse as I kind of go through. So I think a few things. One is postural corrective tools are okay for like short-term type stuff if it works for you. But I think one of our goals in doing this presentation was to kind of amplify how important it is just to get up and get moving throughout the day to get those really positive benefits that Rob was talking about in your workday.
Thanks. And just to sort of generalize on one last question I've got here, it's challenging these days, of course, to have access to the sorts of equipment or evaluation that we might normally enjoy. And so I think, sort of piggybacking off of that, looking at resources that are available for that you can do at home, things, this program, for example, doesn't need any extra equipment. I'm just wondering if, just in terms of some kind of closing words, if you have any thoughts for people that are dealing with the frustration of not having access to those things, trying to figure out where to access those things. Any thoughts from any of you on that?
I can, I guess, start that off a little bit, and if Rob and Brandon, again, have anything to say, just follow up.
I think with that, I see that quite a bit. I have a lot of colleagues and friends that are having that issue. Gyms have closed down, they don't have any equipment, and they're getting pretty frustrated. I've been blessed in certain ways that I have access to a facility, but tell those individuals, it's like, you know what, if you go on to YouTube or Instagram and that kind of stuff, there's a lot of personal trainers offering exercise that you don't need any equipment for. So if our program's too easy, for instance, you can follow one of them or reach out to any of the local trainers in the city and see what kind of services they provide. And if they have, no equipment workouts, it's great to do, try it out. A lot of this is going to be self-motivated, and that's the tricky part too, causes more frustrations like we answered earlier. But I think a lot of the online resources can help. I tell people to be patient. Everyone's kind of in the same boat. So trying to do as much as they can. Get creative. Like I saw a guy using a big water jug to do a overhead press, or like he would carry 2 jugs and do some farmer walks and stuff like that. And it could be a lot of fun getting the family involved too. And getting creative would be the best bet. And I think that's great, because after things open up, let's say they open up, you have motivation to do it yourself at home anyway. So I'll let Brandon and Rob say anything else they wanted to about that.
Yeah, I think, Sunny, you hit the nail on the head with a lot of those comments there. And I'll just add just one, and I think that we are naturally social beings, being humans, and we really like to do things as a group, and that sometimes gives us that internal motivation and keeps us accountable. So like Sunny said, maybe there's some active groups out there where we can join a Zoom workout class, or where we can work out together, because I think that atmosphere just really promotes just us feeling good and feeling happy about those workouts as we come together, and it keeps us motivated to stay active.
Yeah, I couldn't agree more. I think I think it's a great opportunity right now with with Zoom, with comparable programs. My wife, for example, has been offering an online fitness class a couple days a week, and sometimes we have 12 people, sometimes there's 3 or 4 of us, but it's always a lot of fun just to kind of see everyone's face at the same time. There's always some chat afterwards and stuff like that, and it's I guess kind of an interesting exercise in exploring different options for socialization as compared to what we would do before. But there's still lots of great exercise options available, whether it's like minimal equipment resistance stuff, or lots of cardio options out there too, going out for a run, fantastic. So yeah, it's a barrier, but don't let it be an excuse, I guess, is what I would say.
Well, Sunny, Rob, and Brandon, thank you so much. This advice is just super relevant to all of us right now. And speaking personally, I know this is going to really improve my own work from home routine. So thanks a lot. Thank you as well to everybody who's watching today. This new Rehab Med live series is all about our faculty and alumni coming together to uplift the whole people. So if you have expertise that you'd like to contribute, or if you have any ideas for future topics that you'd like us to cover, please reach out to me by email. Just reply to the message that you received with the live stream link. On May 13th, 2 weeks from today, we'll be having a presentation by Dr. Mary Forehand, Chair of our Department of Occupational Therapy. And she'll be talking about finding meaning in the midst of disruption. So check out our website for more information on that in the coming weeks. It's rehabilitation.ualberta.ca, and that's in the chat as well on the live stream. So thanks again for tuning in. Thanks again, Rob, Brandon, and Sunny, and hope to see you all at the next one.
Thanks for having us.